Now, let me discuss the questions in the topic of JVP. 60-year-old man presents with progressive symmetrical lower extremity edema. Which of the following findings would be inconsistent with the diagnosis of the right heart failure? The options are 𝐒𝐮𝐬𝐜𝐫𝐢𝐛𝐬𝐜, prolonged prothrombin time, diarrhea, elevated bilirubin level, pulsus paradoxus. So, in patients with right heart failure, you will have 𝐒𝐮𝐬𝐜𝐫𝐢𝐛𝐬𝐜 and you also have the presence of prolonged prothrombin time. Why? Because in patients with the right heart failure, what will happen to the status of the liver? Liver is completely congested, right? So there is liver congestion. So once there is liver congestion, what will happen? The metabolism of the bilirubin does not occur. Synthesis of the coagulation factors will not be there. So thereby what will happen to your prothrombin time? Prothrombin time will be elevated. Why prothrombin time is elevated? Because the coagulation factors are not synthesized. So there will be prolonged prothrombin time. And in patients with right heart failure, you have to understand that once your liver is congested, what will happen to your portal venous pressure? Portal venous pressure increases. So the individual will have portal hypertension. So once the portal venous pressure increases, the portal vein is receiving the blood from the splenic vein. So splenic venous pressure increases, and once there is portal venous pressure is increased, there is also increase in the superior mesenteric venous pressure. So once there is increase in your superior mesenteric venous pressure, like what will happen? Your GIT, that is intestines, cannot drain the venous blood into your superior mesenteric vein. So there will be intestinal wall edema, right? There will be intestinal wall edema. And because of this intestinal wall edema, the absorption of the nutrients does not occur, and that will result in diarrhea. Okay. And once liver is congested, the bilirubin does not get metabolized, so there will be elevated bilirubin level also. So now the finding which is inconsistent to your right heart failure is the pulsus paradoxus. Pulsus paradoxus is a condition seen in patients with a cardiac tamponade, not in patients with right heart failure. Okay, so this is about the question on the topic of your JVP and as well as the 𝐒𝐮𝐬𝐜𝐫𝐢𝐛𝐬𝐜 as well.